Eh. Sanmukh, smile. Eh. Show me your teeth. Shanmukh, show me your teeth. Eh. Eh. Oh my God.
Come on.
Huh?
Come on, Sharma. Correct.
Say, give me a smile.
Smile.
He's mirroring now. Eee. Where's Papa? Where's Papa? What do you call in your language? Appa?
Nana.
To your father?
Nana.
Father
Daddy.
is Nana?
Daddy. Both.
Oh, Nana.
Chinna. Chinna Judu. We both call with the nickname Chinna Chinna. With that he can respond easily.
Oh, so his name is Chinna.
I call her Chinna.
Ah.
She call me Chinna.
So he thinks that
someone both is calling, he look both of us.
So he thinks that he's also Chinna. Yeah.
Chinna.
Are you Chinna?
Chinna Judu.
Chinna? This Sharma hai. Chinna?
Emi Nana. Hey, Shanmukh.
Shanmukh to Chinna. Ah. Chinna.
He's addicted for that word.
I know. That's what he is responding straight away.
Chinnai Judo.
Chinnai Judu? Chinnai.
Ha.
What does it mean, Chinnai?
Chinna nickname is gold.
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 Are you gold? You are titanium. Huh? Better than gold. Huh? The gold produced titanium. Yesterday he was so strong. It took us 6 people to hold him when we were doing the treatment. So when you came to us the first time, what were the issues that you were facing with Chinnai? What is it? Shanmukh. Now I'm confused between the two gold and the Sanmukh.
No.
Huh.
You told me. He was unable to sit there, crawl, crawling, stand, speaking, drooling, and the vision, way of seeing. Mainly eye vision.
Eye vision.
Neck holding, back holding. There are a lot of problems.
Now you had one set,
Yes.
3 months, which is there. You came back. What are the changes that you have seen in him?
Main thing is way of seeing. It's a lot of difference.
Okay. So when we talk about because the MRI of this child has HIE and also has PVL. So when we are talking about HIE, which is hypoxic ischemic injury, so this is where the oxygen level does not reach certain areas. In his case, it is also the occipital area, which is much more related to eyes, ears, mouth, swallowing, everything else. And then the peritoneal lobe, which is again related to passing the message towards the muscular abilities of the baby, right? And also emotions. So now I can see that he is able to understand anger.
Yes.
Like he is able to understand when I'm
Happiness.
smiling, happiness,
Smiles.
which wasn't there before.
Before not there.
He was
Not there.
didn't respond at all.
Hyper anxiety was reduced completely.
Hyper
More
anxiety.
main problem
Yeah.
that it is has been reduced.
Yeah. So he was also diagnosed with dystonic behavior. So when we call dystonic behavior, sometimes dystonic behavior also has a lot of involuntary movements. That what you talk about restlessness. It wasn't restlessness. It was more to do with his hyperness, as in involuntary movements. He didn't have control over his body moving. It was mostly movements which he could not tilting. Now he's standing on his 2 legs, he's taking the weight on it, he's not moving, he's controlling his head. Before it was going round.
Yes.
Right?
Yes.
And even the body would fall on one side,
Yes.
right? Which is not happening now. The alignment of the body is completely straight compared to when you came on the first day. Okay? Also to prove, right, the reason we do this is because a lot of people or a lot of doctors, they say it is a placebo effect. I always say placebo effect can be done with an adult. You can manipulate an adult's mind to behave in the way you want to behave, but you cannot use placebo on a child, because a child doesn't even know or doesn't understand. If he did understand, he wouldn't be with me, right?
Yes.
It is so. This is the hearing that we do ASSR. If you look, before there was hearing loss. When you came to me, you said he can't hear properly on one ear. Now if you look at this, the hearing sensitivity is under normal limit. Okay,
Yes.
and he's also responding. That is the proof. See, this is all documentation.
This
But
is
the
proof.
biggest proof is when the child, you
Is
call the
responding.
name and he's responding straight away. Another one, eyes. When they came to us, the eyes were something of a problem, where eyes were not responding anything.
Eye contact.
Eye
Eye
contact
contact was
There
was
is
not
no
not
eye
there.
contact.
Again, the VEP study has come normal. Okay, so this is corresponding with the results that we can see with the child. So when you are playing with him, he's responding. Now he's looking at you, he's getting angry, he's seeing what you're talking about, he's observing the surrounding. When you said he entered into
Yes.
the room,
Room,
he
he's
knew.
crying.
He's crying.
He was crying because he knew that this was the therapy room. Good. So another one that we do when there is a dystonic behavior of a child and there is involuntary behavior, we always check for neopathy. So neopathy is basically, we determine that if there is any blockages, anything which is there in the child, which is creating this involuntary movements. Okay. So when we did this test, in the first set,
time. NC.
yeah, so this, there was issues. If you look at this part, okay, so you can see that there was a sensory motor axonal polyneuropathy. Okay, now if you look at present, which was done yesterday,
Yes.
Yes.
Yesterday we had done.
it is coming normal, right? See, this alone proves that it is not just what the parents are feeling the change, but it also determines medically that your child is improving.
Yes.
It is getting normal. So when we are taking these things into account, we know that the brain is responding completely to the therapy that you are giving, what we give you at home, the diet that we give you at home, and also the treatment that happens here. Now, another concern that you came to us was, having seizures, right? So how many seizures did he have before?
The delivery time we had seen that.
Every time.
Delivery time.
Delivery
first 3
time
days
he
they
had.
said.
But
Then
this
it-
EEG never used to come normal, right?
normal, yes.
Okay.
Sleeping time is a stroke, sir.
He had strokes, right? So when they came first to us, the EEG was much more bad, worse than what it is today. Before, it was the myoclonic seizures that they used to get. It is also known as the West syndrome side of things. But now, after they've taken this one set, there is only one focal seizure and there is only few spikes which are coming. That is on the left side. Only one area of the brain, which I told you, the frontal area.
Frontal area. Left side, frontal area.
Left side near the eyes.
Eyes.
And that's why there is, the eyes are also showing normal now. So the seizures are also controlled compared to what it was
First.
before. Now this is all medically proved. I keep this as a data because whenever I talk to any of the hospitals to prove that these kind of children can get better, We don't have to put them on severe medical medicines and things like that. They don't believe that these kind of changes can come. I'm sure your doctors
We are
said the
happy
same
with
thing.
this treatment, ma'am,
Yeah.
first of all. Why? Because we lost the 14 months treatment in the Prashanti Hospital at Hanmakonda.
Yeah.
So the
Yes.
pediatric doctor
Hmm.
Niranjan in
Hmm.
Hanmakonda, he
Hmm.
lost completely with this effect only. My baby is in this condition. Why?
Book
Because
knowledge.
he's a book knowledge person. We identified after 14 months.
Hmm.
From day 1 to 14 months, we went there only to
Hmm.
show my baby. For
Did not
every
give any
month,
PCR.
without any problem, we have to consider why, because in a severe condition he was in.
Hmm.
So till that long period,
Hmm.
he didn't give the for seizures syrup also.
Okay.
So that damaged a lot. Then
Yeah.
after 14 months in the rainbow, they had started.
Hmm.
And after knowing we come here, we are happy with this treatment, with the first visit only. So a lot of differences in my child.
He's also standing now.
No, this is the first time I am seeing my child sleeping in a sitting position. He never slept like this.
He's gone to sleep now.
First time today I am seeing.
He's relaxed.
Somewhat I am feeling happy.
That's very good. And your dream of seeing your child sitting, which he is now,
So I'm
right?
happy feeling that.
So you know that next time
I believe
going
next
to-
visit
He
his
is
friends
going to
sitting.
sit or work. Definitely it is going to be done in the next visit.
will be
We are
done.
thinking.
it will be done.
Hoping
And
God is-
see, every changes that come, we've got proof.
Yes.
Okay? So it is not something that anybody can deny, because we are not doing it from any local hospital, or we're doing it from research hospital.
Ah,
Right.
yes.
So Mahant Indresh
Experienced hospitals.
experienced
20
hospitals.
years.
So, when we are doing these kind of tests, it proves that there is a stimulation which is happening in the brain, and children are getting better faster. See, what people forget at this age, the time is of the biggest essence. And I know parents who regret not coming here regularly. They came in 2019 when I was giving the treatment, and they didn't continue because they thought it was expensive or whatever it was, and they discontinued. They went to all the other cheap options that they get.
And there is no result.
There is no result, and it got worse.
First.
And now they are ready to give in everything and say, please take care of my baby. Right? So what happens is the time frame which we can have faster recovery is taken away. Why? Because the parents decide for the child that okay, it is very expensive, let's go for the cheaper version. It is like you give a medicine which is original medicine, and you give a cheaper which is not the original. Okay. Now what happens is, if it fits the child, it's fine, but if it doesn't, it makes it worse. And it has happened to many children, unfortunately, because we are always looking for cheap, but cheap doesn't mean the right therapy.
Yes.
I always say that, because don't have regrets afterwards that, oh, I could have spent that 10,000 extra, or I could have spent that 20,000 extra. And this is where the problem lies in giving treatment to the child. Is they're comparing. There is no comparison. The treatment that I do and the treatment that they receive at the cheaper rate is not the same.
Yes.
You have experienced many therapies. How many years of different therapies you've done?
So physiotherapy we had done for
Physiotherapy
2 years.
Huh.
With that a little bit improvement by
Huh.
and,
Medicine also
medicines also from Rainbow Hospital
Huh.
and in Hanmakonda, in our local itself.
Yeah.
Little influence, but there is
No
no
result.
perfect
Huge.
improvement.
Not something that you can
Yeah.
prove.
It's a
in the-
proven we can't get it.
Yes.
Somewhat after coming over, we get the proofs.
Proof that there
The
is an
medically-
improvement.
the
He's a
medically.
normal boy.
Yeah. He's normal
Now we are
boy now.
thinking is like normal. We are thinking. Before
No.
that we suffered a lot.
Now he will get better. See, PVL, HIE, all of these things are curable if the child is as young. They come to me as, when they have the injury. If they're having an injury, if they come to me within 3 months, this can heal faster. The longer, the longer it becomes to heal, and then we start giving a lot of medications. So what happens is that the medication side effect also we have to treat first, and then we have to reach out to the brain. So with majority of the anti-epileptic medicines, what I have seen is, one is vision loss, hearing loss. There is also loss of muscle waste is there. So the child suddenly cannot use the hands and legs and things like that, and they will lie down on the bed all the time. There is no activity, there is no response. Slowly it is like the child is just lying down and has got their eyes open. So these are mostly because what they're trying to do with medications is that they're trying to numb the brain completely so that there is no seizures. But that does not help the body, because if at that age, if the body is not growing, what's the point of having a child, right?
Because of
So-
medications.
Yeah. So I always say that, like you've made an effort of coming all the way from South India
Yes,
to
lot of
here,
efforts.
right? But you saw the change, and that's why
Happy
you
for them.
made that effort, right? And looking at their effort, I think people should learn from them, because they were not getting appointment at my center over here, and they went to the governor. Was it governor?
Central Minister.
The central minister,
Related to
they
state.
got a letter from them, and I got a call from them to give them an appointment. Now that is dedication. So he's a father and the mother who knows the importance of time and how important it is for the child to get the right treatment at the right time. And I think all these changes that you're seeing, it is all your hard work, both of you. Okay, so keep giving that treatment. I was telling my another patient as well. He kept on thinking his child is going to get sick because he normally gets sick. So I said to him, I said, don't think that way. If you think, that chapter will open. If you don't think, you think a better chapter,
Yes.
that better chapter will open. Okay, so now in the next set, I want him sitting.
Sitting.
Okay, he's already putting quite good balance in
Okay.
front. Okay, that is the proof. He's standing on his 2 feet. Now he's also walking, jumping, everything is fine. And now he's understanding as well. But you have written a lot more, I think, in the
Drooling also little.
in
bit.
drooling also improved.
Little
Okay.
bit.
So there is,
Anxiety.
yes, it says present partial neck holding. That is what you have written.
Yes.
Holding toy, but not perfectly, but started holding a
Holding.
toy. Drooling, control lightly. Crawling like a rabbit jumping.
Yes.
Yes.
Hands perfect.
Hands are coming
But
perfect.
legs
man.
jumping.
Legs are
Jump.
zigzag not coming, man. Just is
Jumping.
jumping.
Okay.
completely.
But this is all happening in just one set.
One
The
set.
first set. Both hand holding partially. Swallowing of food 80%.
It's good.
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 Sitting started.
Start.
Holding chair and standing on knees
Knees.
for 1 minute.
1 minute.
Started standing. Good. Head size increased 2
2
centimeters.
centimeters.
Increased all body
Body
parts
parts.
and weight gain.
Big.
So I would say that we have achieved at least 20-25%
Yes.
of the improvement from the last
Last compare.
comparison to the first time
First
when
one.
you came. So you are happy with
Happy.
the results.
Happy man.
Very happy.
Very happy. That's why I'm coming in 3 months.
Good. Keep doing it. Don't listen to
I'm go to my home.
Yeah.
After 1 month, I'll book appointment. Next appointment also.
also already done.
Planning, man. We are planning the budget.
The planning the
Ah,
budget,
budget.
but you know,
Budget mainly problem. We are thinking for next visit how to do.
do you know what I used to? I used to give treatment for 5,000 before.
Ah, yes.
I was working with another doctor and I used to take only 5,000 because I was collecting data. So we do that. We so that we get more people. If it is 5,000, you will get more people who needs the
Yes.
therapy. So when I was doing that, people didn't care.
Yes.
People didn't care about the
Didn't
therapy. They did not think that, oh, you know, this is a new doctor from London. God knows what she. And I didn't know how to talk in Hindi. So that was also a drawback because I only knew English.
But
So-
no one can treat these patients perfectly.
No, you have to give time. See, this is where, you know, people and parents are going wrong, is that they take them to places where there are a lot of kids like that. Now what happens is that if there is a lot of people, your child is just a number.
Yeah.
There is no observation of any kind of what are the changes. It is only you as a parent who will see the changes. They will all be doing the same thing that they've been doing to another 5, 6 patients, you know. So when you are getting a tailor-made treatment, when you are here, you are always in the center. Your child is always getting that treatment. I am speaking to you, I'm doing those things. So when that happens, the child is connecting with me consciously. When we say conscious, we are not being of just flesh and words. We are energy, right? So when you're an energy and you are in front of somebody who's not well, that energy connects with the healer. And then the process starts happening. If I see 100 patients in a day, I cannot connect with each and every one.
Yes.
Right? So this is a very different kind of channeling that happens, which people don't understand. It is mostly because everybody has only heard of physiotherapy. They've
Yes.
only heard of occupational therapy. They've only heard of maybe few other therapies that take place like panchkarma and things like that. They haven't heard of these kind of treatments which happens only in the brain. Because without the brain, our whole body is useless. So that is why this guy always stares at me, if you have noticed. Because he knows.
Patients की example అవ్వాలని చెప్తున్నా.
हाँ क्या कह रहे?
She's saying
Huh.
after my son completes setting, it will be the example in our
So many
state, in our
patients.
place.
He started sitting partially, so we are halfway there.
That's why I'm telling you, I'm very
It will
happy.
be
Yeah,
example.
we are halfway there. So now next time in 3 months, I want mithai
Okay, sure.
from your village.
Okay.
Sure.
Which temple is near you?
Subramanyeshwara
Subramanyeshwara
Swami.
Swami.
Good. You take that mithai to Subramanyam temple and then you bring for all of us.
Okay.
Sure, ma'am.
Compulsory.
Compulsory when he
Yeah,
starts
sure.
sitting. And you give everybody with his hand.
Sure, ma'am.
Yes?
Okay.
Little bit is still holding like this only, ma'am.
Yeah, but the laddu he will hold very well, I'm not. So this is not difficult. It is simple. Only the problem that we as parents face is that we take everything in a limited vision. We take the vision of other doctor and we make that our vision, which is something that we need to stop doing. Your child is something which has been manifested with your idea of having a child, right? You wanted a child, you got a child.
Yes.
Now, if somebody thought of having that you should have a child, that would never happen. You have to think that you want a child first. A mother will only become a mother when a mother wants to have a child, right? Otherwise, no matter what, you will never conceive.
Oh no.
Yeah. So you have manifested yourself as a mother first, then you manifested having a child, right? Now the child is yours, both of yours. So why are you making somebody else's vision that he may never walk? Your vision.
Oh.
Your vision should be my child will go to the school, my child
Yes.
will do everything.
Everything.
That's all. Never take somebody else's vision of your child as your vision. You know, when the doctors say, Arey, he's never going to walk, he's never going to talk, he's not the parent. How can he decide whether
I'm
he's going to
always
walk?
thinking
or
about the positive side.
Good. And I'm telling that to each and every parent. मैं हर पेरेंट को ये कहती हूँ कि बच्चा आपका है और आपकी ही सोच से वो चलेगा, दौड़ेगा और पूरी जिंदगी अपने आत्मविश्वास पे वो अपनी तरीके से जी पाएगा जब आप अपने मन से ये डर जो है वो हटा देंगे कि मेरा बच्चा कभी कुछ नहीं करेगा। ये डर हट गया और अपना विजन आ गया कि हाँ मेरा बच्चा सब कुछ करेगा, तो आप देखना इनकी तरह भी जैसे 3 months के अंदर इतने सारे चेंजेस आ गए हैं, तो आपके बच्चे के अंदर भी आ सकते हैं। सो आई जस्ट वांट टू से दैट होप फॉर अ बेटर फ्यूचर एंड यू विल गेट दैट। आपको अपनी लैंग्वेज में कुछ बोलना है? Yeah, we have lot of South visuals. अरे you speak ना, you know a lot.
మదర్ కాబట్టి
हाँ.
బాగుంటారు కన్విన్స్ అవుతుంది పేషెంట్స్. ప్రశాంత్ హాస్పిటల్ నేను మెన్షన్ చేయి.
నువ్వు చెప్పావు.
గుడ్ ఈవినింగ్ అందరికి. నా పేరు శివ అండి. నేను తెలంగాణ నుంచి వచ్చిన వరంగల్. ప్రశాంత్ హాస్పిటల్లో డెలివరీ అవ్వడం వల్ల నా బాబు ఈ కండిషన్కి వచ్చింది. నేను ప్రాపర్ టైంలో చేయకపోవడం వల్ల అండ్ నిరంజన్ డాక్టర్ పీడియాట్రిక్ డాక్టర్ ఆయన కరెక్ట్ ట్రీట్మెంట్ ఇవ్వకపోవడం వల్ల సో ఆఫ్టర్ లాంగ్ టైం యూట్యూబ్లో చూసి నేను మా ఫ్రెండ్ని ఇక్కడ పర్సనల్గా ఒక 10 days పంపించిన ఎంక్వైరీ పర్పస్లో. చేసిన తర్వాత చూసిన తర్వాత ఆయన ఇచ్చిన ఫీడ్బ్యాక్ని బట్టి నేను మా బాబుని ఇక్కడ తీసుకురావడం జరిగింది. సో మేమైతే చాలా హ్యాపీగా ఉన్నాం. ఎందుకు అంటే బాబు ప్రీవియస్కి ఇప్పటికి చాలా ఇంప్రూవ్మెంట్ అయ్యాడు. ఇంకా మేము అవుతాడని చెప్పేసి ఎక్స్పెక్ట్ చేస్తున్నాం. ఇంకా
HIE stage 3 is a severe problem. Hyderabad Rainbow Dr. Lokesh Lingappa is the best neurosurgeon in our state Telangana. ఇది HIE stage 3. నాకు నార్మల్ డెలివరీ అయింది. డెలివరీ టైంలో ఎపిడ్యూరల్ ఎనల్జీసియా ఇట్స్ ఈక్వల్ టు ఎనస్థీషియా ఇచ్చారు. 2 doses ఇచ్చారు ప్రశాంతి హాస్పిటల్లో. బాబు బ్రెయిన్కి ఆ ఎనస్థీషియా అనేది బాబు బ్రెయిన్కి ఎక్కడం వల్ల బాబు డెలివరీ అవ్వగానే 3 days ఏడవలేదు. ఏడవకపోవడం వల్ల సీజర్స్ 3 days కంటిన్యూస్ సీజర్స్ వచ్చాయి. మళ్ళీ ల్యాక్ ఆఫ్ ఆక్సిజన్ డిలే brain. HIE stage 3 it's a severe problem. 14 months 14 నెలలు 14 months వరకు మేము ఏమీ చేయలేదు. ఆఫ్టర్ 14 months 2 years ఫిజియోథెరపీ. ఐ వెంట్ ఫ్రమ్ రెయిన్బో. ఆఫ్టర్ నో రిజల్ట్, ఇంప్రూవ్మెంట్ ఏమీ లేదు. ఆఫ్టర్ 2 years తర్వాత యూట్యూబ్లో సెర్చ్ చేస్తే నాడీ యోగా మేడంది వీడియోస్ చూసాము, రిహాబిలిటేషన్ సెంటర్. ఆ వీడియోస్ చూడగానే చాలా మంది పిల్లలు ఇంప్రూవ్ అయ్యారు. మేము కూడా ఎంక్వైరీ చేసాము, మా అన్నయ్యని పంపించాము, చూశాడు, ఓకే అనిపించి మేము వచ్చాము. 3 months ట్రీట్మెంట్ చేపిస్తే చాలా ఇంప్రూవ్మెంట్ కనిపించింది బేబీలో. నెక్ హోల్డ్ అయింది, డ్రూలింగ్ కంట్రోల్ అయింది, ప్లస్ పర్ఫెక్ట్ ఐ కాంటాక్ట్, పర్ఫెక్ట్ ఫుడ్ తీసుకోగలుగుతున్నాడు. అంత ముందుకి ఇవేమీ లేవు. సో ఇలాంటి ప్రాబ్లమ్స్ ఎవరికైనా ఉంటే కంపల్సరీ ఇక్కడికి రండి.
Please do visit this Naadi Yoga Center.
Cure your baby fast. Actually మేము
lot of time
2 years వేస్ట్ చేసామని ఫీల్ అవుతున్నాము లేట్ గా వచ్చామని.
But the results are coming faster. So we are making up for the time you lost by giving this
actually
treatment.
ఇప్పుడు ఏ టైంలో అయినా యాక్చువల్గా ఇప్పుడైనా వచ్చామని హ్యాపీగా ఉంది.
Actually I know regarding this 8 months back only, but I trusted low and I sent my brother to here.
Yes.
I'm not getting time and I had
Yeah.
no leaves.
Yeah.
So after coming here, he spent 10 days But whenever he came inside,
He never
I
came
stopped
inside.
it. Stopped it. So slowly he noticed and say, okay, there are patients, kids
Coming
only
and
treatment
going.
going on,
Huh.
so you can come.
Yeah.
Then I
See, he's a police guy, right? So he makes sure that there are people actually
you
coming
should not
into the
suffer,
clinic.
come and hear other state
No,
language.
absolutely,
problem.
absolutely. See, I always say language
Yes.
is nothing when there is emotions which are
Will,
talking
willpower.
and willpower. See, you came here, you thought language is going to be a problem, but we're fine.
It's going on.
We're going on well. You know, everybody understands the language of love and the language of, how do I say, being in pain, right? You don't need to explain. Even an animal understands the language of pain, the language of love, right? Those are the most important thing in this world, and that is what is running everything, and that is how we communicate to God.
Yes.
Either we communicate in love or in pain, but we communicate, that is the only communication that we completely understand. Okay, so thank you so much. And I think now in 3 months' time, we're going to have him sitting by himself
I can
and
see.
come. Yeah, and laddu. We're going to get laddu. Okay.